Dr. Applebaum, thank you so much for being with us today to discuss the topic of fillers. What exactly are fillers?
Fillers are products that are designed to fill in creases in the skin, typically on the face. There are a number of different types of fillers. The older fillers, such as collagen, are less utilized nowadays because they tend to have a shorter life. They tended to last between 3 and 4 months. And in addition to that, since it was derived from bovine sources, which is cows, there was a small risk of allergy, and therefore testing had to be done for patients. So we don't really do that very much anymore. Nowadays, I would say the most commonly used fillers are the hyaluronic acid fillers, such as Restylane and Zyderm. They're very popular for a number of reasons. Number one, the chemical that makes them up, hyaluronic acid, is chemically inert. And why that's important is it means that there is zero chance of developing an allergic reaction to it. So the patient can be very comfortable that if they are going to have this done, that the worst complication they're going to have is a little bit of bruising, and that's it. That the risk of having an allergic reaction that causes complications later on is zero. So that's very comforting. In addition, hyaluronic acid fillers last a lot longer than older collagen fillers. They tend to last more in the order of 12 months to 18 months. This is true even though initially when we first started using them we were telling patients that they lasted for 6 months, which is still twice as long as collagen. But we found with experience that if it's done properly, it really lasts a lot longer than that. And most patients have it done every year or other year. Additionally, there are some newer fillers. One is called Radiesse, which is hydroxyapatite. The advantage of hydroxyapatite is it's thicker, and therefore it can be used for deeper creases. It's also chemically inert, and therefore it doesn't cause any allergic reactions, and can be used without the concern of an allergy.
Dr. Applebaum, who is the ideal candidate for this filler technique?
I would say that the ideal patient would be someone typically in their 40s to 60s with creases, particularly the mesolabial or nasolabial creases and the submental creases. When patients are a little older, sometimes fillers are not sufficient, and therefore more aggressive therapy is needed, such as a facelift, is needed to correct the lines. But typically, I've been able to use fillers in patients that are above 60 as well. But I would say the ideal patient is someone in their 40s to 60s. The ethnicity is not important. I've done this treatment on people of all ethnicities.
How are fillers different from Botox?
Fillers and Botox actually work in very different ways. Fillers, like I explained, fill in a crease in a mechanical way. Essentially what you're doing is you're placing, with a needle, the product under the skin to lift up the skin in that specific location. It only works exactly where you put it. Botox is a neurotoxin, and the way that works is it actually weakens the muscle in a location about the size of a quarter around where the injection is placed. So therefore, Botox is more appropriate for areas where there are creases and wrinkles caused by muscle movement. Typically, the forehead, like this, or between the eyes, or crow's feet around the eyes as well, are appropriate places for Botox. The creases down here generally are more a function of gravity than they are of muscle movement, and therefore fillers are much more effective in those areas.
How long does it take to notice a difference after getting a filler treatment?
With all the fillers, you'll see improvement immediately. Immediately after therapy, there will be a significant improvement. There is a additional improvement that occurs over a period of weeks to months, depending on the filler, particularly with the Radiesse, which is hydroxyapatite filler. You see improvement that continues for months. But even with the hyaluronic acid fillers, such as Radiesse, such as Restylane, and such as Zyderm, you'll see continued improvement over a period of weeks to months.
Now, if one is considering getting a treatment such as the ones we've discussed here today, how should one proceed?
My recommendation would be to speak to a doctor who has experience using these products and they would be able to counsel you on what product they think was appropriate for you, since different patients respond differently, and the products are slightly different and give different results. So that would be the best way to start.
Thank you so much for your time, Dr. Applebaum.
It's my pleasure.